Well, you are very welcome. It is Thursday, the 19th of March. Now, I just want to start off with a few simple ideas. First of all, make sure you keep this device cleaned. So every time you clean your hands, wash your hands, then clean that with some antiseptic. Dirty things, those. And also, we need to avoid poorly ventilated, crowded areas. You'll have to work out where they are in your environment. Now, the next thing to say is we need to consider people around us and consider joining one of these local help groups that have been set up. Think about who the vulnerable people are in your area. Everyone has a role to perform in this. Because these restrictions that we have now, basically, I think they're going to go on for a long time. Basically, till we get a vaccine. So life is going to change as a result of COVID-19 until we get a vaccine, and this could be quite a long haul. Now, I've actually been predicting, I'm not a virologist, but all virologists around the world have been predicting since I started teaching this in the 1990s. I used to say to the students, a viral global pandemic is not a case of if, it's a case of when. So the virologists have been aware of this for a long time. So I've been aware of this coming for a long time. And this particular outbreak I've been predicting since January. But now I'm actually seeing the reality of it and realising that we're still in the relatively early stages of this pandemic. I'm not going to pretend I'm not struggling with the enormity of what's happening. So if you're finding it difficult, please know I'm finding it difficult, and we're struggling. We're struggling together. Now, a little bit of good news that's coming on. The government in my country is instituting an antibody test in the near future. Now, what do we mean by this? Well, the antigen is the virus. That's what the body recognises as being foreign. And in response to that, in response to the virus, the body makes an antibody. So this is the virus and this is the antibody. And the antibody will clump onto the virus like that and neutralise it. And this antibody is a specifically designed protein produced by the body's white blood cells, produced by the B lymphocytes, that can inactivate the virus. That's how we're going to get immunity ultimately. So you can get this antibody in one of two ways. One is it can be stimulated by a vaccine, which is good, or you can get the disease, and the disease will cause the stimulation of the antibody. Now, when the condition resolves, the antigen, that is the virus, will go away because the antibodies will eradicate it. So the antigen is going to go away. So a week or two after someone's had the disease, let's say 7 to 10 days after someone's had the disease for most people, the antigen is no longer going to be present. It's going to be gone. So if you tested when someone has the antigen, then you know they had that. But the thing about this antibody is this is going to hang around for a long time. A year, 2 years, 10 years, 20 years, for life. We don't really know. Certainly a long time. Now that's important because if the virus comes back, the antibody's there and will quickly eradicate it. This is what we now believe. We now believe that people will be immune who've had this infection. We're open to further evidence, but that's what we believe at the moment. So that's good because it means once people have had the antigen, the antibody will be there. Once bitten, twice shy, if you like, and it knows it's there. But the other thing about this is we can do tests for the presence of this antibody that's going to be there for years, if not for life. And we're developing tests for this antibody at the moment. And this is absolutely crucial because it means if someone's had an infection and we test for the COVID-19 antibody and we find that antibody is present, that means they've had the infection, and the presence of the antibody means that they're going to be immune, so they can basically go back to a normal lifestyle after that. They're immune themselves, and because they're not going to get the virus, they're not going to transmit it onto other people. So unfortunately, this means a lot of people, as we know, are going to get the infection, indeed have the infection now. But people that we don't diagnose with the antigen at the time, because we're short of these specific antigen tests for the virus, we're going to be rolling out this antibody test. And this is going to be all around the world, I'm sure. And we can see who's had the virus. Therefore, we can infer from that who is immune. So more and more people who've had the virus should start getting back to normal. But it is going to be a trickle to begin with. And Europe now is the epicenter of this, and Europe has got more confirmed cases now than were confirmed in China. So Europe is very much an epicenter of this now. But hope, in two lines of hope here, really, basically people have got to change their lifestyle. We've got to have this social isolation, and it's going to go on for probably the next year. But as more and more people get the infection and get the antibody, they'll be immune and can go back to normal life. They'll no longer be spreaders. Then hopefully next year in 2021 we'll get the vaccine. The vaccine will be antigenic but not cause the disease, and that will stimulate the antibodies. Then if the disease subsequently comes along, the antibodies will eradicate it and we'll have global immunity. But that's for next year. So quite a bit of hope there, really. But in the meantime, we can't pretend that life is going to be the same for the next year. So there are those points I've made there. Now, going on to the World Health Organization, unprecedented risk and unprecedented opportunity to work together and work collectively on this. And the World Health Organization is saying we need urgent aggressive actions as cases soar in Southeast Asia particularly, which is a concern we'll look at as well. Now, total number of cases confirmed in the world is that. Total number of deaths is 9,115, but 84,000 plus people have now been confirmed to have recovered from the virus. Now, China have had no new cases. Only 34 backflow cases. Now, I'm always criticised for this. Why do you accept China's figures? You're naive for believing China's figures. Chinese lie all the time. Well, these are verified. They're actually verified by my government apart from anyone else. I know the governments around the world who accept these figures, and they're verified by World Health Organization people as well. So I do accept these figures, and if that makes me naive, okay, so be it. But I believe it is the case. I think we've got good scientific evidence for believing they are the case. So they've had no new cases of internal transmission yesterday. Just 34 backflow cases, people coming from Europe bringing the disease back, showing that the social isolation measures work, I believe. Now, if they start lifting these restrictions, we don't know what's going to happen. That's for the future, but it does show that the Chinese have been managed to get the R0 for their transmission figures well below 1, and no new cases in China reported. Now, Taiwan is also, Taiwan off the coast of China there, also another very successful case, really. They had initial cases ages ago, probably early February or maybe even January I think, because it's so close to China. And now, but they've only had a total of 108 cases because they've been remarkably proactive. As I've been advocating since we started doing these videos in January, we need to move from reactivity to proactivity. They've been very vigilant. They've had good testing. They instigated early border controls, not allowing their nationals out and not allowing foreigners in. They had stringent quarantine, and they've got mobile phone tracking. So people are individually tracked on mobile phones, as indeed is the case in South Korea and Israel. Now, I know there's a lot of Big Brother sort of social control factors here, but the mobile phone tracking does seem to be working. Now, Thailand is a concern. The cases in Thailand are obviously grossly underreported. We know there's a boom of cases in Southeast Asia at the moment. Thailand, I'm worried about Cambodia, Laos, countries around there. Though Vietnam has been very proactive. But this is just so disappointing because we've been really optimistic about the virus not spreading in hotter environments, because of course Thailand's never cold. It might drop down to the mid-20s at some points, but it's basically 30, and it's a tropical country. And yet cases there are increasing now, so that's very disappointing. South Africa, 120 cases. But again, probably underreported. And that does bring me on to thinking about the African situation. These African countries, cases reported all over Africa now, still very limited testing. But so much poor nutrition, and we know poor nutrition reduces the efficiency of the immune system. So much human immunodeficiency virus causing varying levels of acquired immunodeficiency syndrome, AIDS. And health challenges of an incredible nature, but both of community health in that people live in very difficult environments, to very crowded environments, very often very difficult to maintain good hygiene, and of course severe lack of facilities for testing, severe lack of facilities for care when people do become ill. Now, if 12 to 15%, depends who you're listening to, of people are going to need medical interventions, 4 or 5% of those are going to be critical. Basically, in African countries, that is not going to happen. So I absolutely hate to think what the case fatality rate is going to be in many African countries. Let's hope there's massive organisation and aid to people suffering in that part of the world. Now, South Korea is also doing very well. A lot of confirmed cases, of course, but a great decline in new cases due to their stringent shutdown, their testing, their contact tracing, their quarantine, their social distancing. They've been doing it all. But new clusters are emerging around Seoul. But of course, they're still testing, contact tracing, quarantine, and distancing those clusters. So I'm hopeful South Korea can keep these under control. South America, major concern. Chile, a state of emergency declared. Brazil, increasing cases in Brazil, 4 deaths. President Bolsonaro has previously been on record as saying this whole thing's hysteria. That is terrifying, that you have world leaders that can basically ignore what we know about science and medicine. I mean, in science and medical science, there's a lot of things we don't know, and I'm always the first to admit what I don't know. But there are things we do know as well, and since January we've known this is a very transmissible virus. I've been saying this since January, and to ignore that science and say this is hysteria is, Peru and Bolivia borders closed, so some proactivity there in South America. Now, the United States, this number is going to massively increase. Of that, there is no question. It's going to be 10 times that before very long, I'm afraid. Every state is now affected. Land border with Canada's closed. 130 deaths so far. Two big medical military ships deployed. One's been deployed to New York, which I believe has got a 1,000-bed facility in a military and medical ship. Better than nothing, but I fear it won't be enough. The President of the United States has said he's now a wartime president, so good realisation there at the top. And let's hope he carries on behaving as such, which he does seem to be doing now. Slow start as in many places. Missed opportunities, absolutely tragic missed opportunities. In the United States, in China right at the start of this, and all over the world, of course. Modellers in Imperial College London, led by Professor Neil Ferguson, who is himself in quarantine at the moment, have estimated without the interventions the United States would have had 2.2 million deaths. Some areas of the States are only a week or two behind Italy. So again, the curves are going to be of different levels of steepness in different parts of the States. They're going to be occurring at different periods of time. Some will be sooner, some will be later. But some areas of the United States are expected to be in a similar situation to Italy in 2 to 3 weeks. 2 to 3 weeks' time. Distressed to see people partying in Florida this morning as if there was no issue. Social mixing, young people together. Everything that entails. presumably. Also California. Glad to see the president was telling them off. Personally, I would have sent in the National Guard to break them up, but I don't know how this works in the States. But really frightening that still so many people are still not taking this seriously, as we've been talking about since January, and some people still don't seem to have got the message of how important this is. Yeah, right. United Kingdom, my country, cases increase. Testing is actually at about 5,000 a day at the moment, so not impressive. But we are expecting this antibody test, this all-important antibody test, to come in soon, which is going to be an immense weapon as we combat this infection. And I know countries all around the world are working on this, and this is going to be rolled out soon. And hopefully it'll be a very simple test. I'm expecting just a prick of blood on the finger, and it'll be a bit like one of these pregnancy tests where it just rises up and settles out and you see a line. That's what we're hoping for soon. And that's going to be incredibly valuable, as we know who is no longer going to be infected and who is going to be immune and will not pass on the infection. But as of now, the only way they're going to get that is from having the illness themselves. But thankfully, we know that many people have a mild illness. The vast majority of people have a mild illness. Schools closed until further notice in my country. Local help groups forming, which is encouraging. Find out where your local help groups are and please help those around about you. We need to do this together. London transport reduced. Now, there's been less buses and undergrounds, but some of them have been a bit crowded because there's less. So that's kind of a bit of a double whammy there, really. It's good to reduce it, to reduce travelling, but if it means that the ones that are left are more crowded, then that's bad. Now, Manchester football team and various footballers in Manchester who own hotels have opened up these hotels free of charge to healthcare staff. Now, this is of immense importance because it means that nurses and doctors can go to work and then go to the hotel in the evening free of charge, courtesy of some of these hotel owners in Manchester. And not have to worry about taking the virus home to their loved ones. So significant and generous gesture there. The hotels are going to carry on being staffed. They're going to be closed to all outside guests and only healthcare workers are going to use them. So that's a very magnanimous, generous gesture. And but it's exactly what we need. We need the best to come out in people. Let's bring the best out in people. Let's work together on this. That's very encouraging to hear that. 20,000 military have been deployed in my country. Not quite sure what they might be doing. Probably backfilling for police. Possibly soon enforcing quarantines as well. Now, the Braemar is a cruise ship. Dear me, the debacles we've had with cruise ships. It's not funny, it's serious. The debacles we've had with cruise ships. So it's been stranded at sea for over a week. Confirmed cases on board this cruise ship, this Braemar cruise ship. So refused entry to quite a few countries, including the United States, who refused entry. Taken in by Cuba. I mean, what can you say? Just the Cuban government saying at this time we need a sense of humanity. So these people have been bobbing around at sea. Okay, you could argue that they shouldn't have gone on the cruise in the first place. Well, I certainly would have argued that. But given that they were, Cuba have arranged for flights back to Europe, including my country. Let's hope we just get them properly quarantined. So very magnanimous gesture there by the Cuban government, who are under no obligation to do this whatsoever. So we've got individuals taking action, liberating their hotels. We've got Cuba taking action to help other people. So very, very encouraging gestures there. Now, people are flying home on aeroplanes who are infected, so the cross-infection risk there is frightening, but still a very magnanimous gesture by Cuba, allowing this cruise ship to dock there. Let's hope they don't fill it up with passengers again. Cuba itself has 11 cases at the moment. Now, Italy, a lot of cases. Now, this is the biggest increase in deaths. There's been 475 deaths yesterday and over 3,000 deaths now. The lockdown that was due to be enforced till April has been extended, including schools. 8,000 people have been fined for breaching the quarantine. And in a country, that's not too bad. It's still disappointing, but 8,000 people in a country, it means that most people are cooperating with this, I believe. Another brilliant magnanimous gesture, medical teams from China have arrived to advise and help the Italian medical authorities. So, very good gesture there from Cuba and China. In fact, more than a gesture, these things will make real differences to people's lives, for sure they will. Again, the military involved in various ways now in Italy. So Italy at the forefront of the European epicentre. Spain not too far behind, unfortunately. 2,500 new cases yesterday. Now, I've said many times that the lockdown now is in force. The testing's not where we want it to be, but the contact tracing's getting better, the quarantine's getting better, the social distancing especially getting better. So we don't expect to see a drop in cases straight away because of the incubation period. But we would expect to see a reduction in the number of new cases in Spain in the next week or two. And some epidemiologists are predicting that the peak in Italy is going to be in the next few days because they've done such a lot of social shutting down. A lot of deaths in care homes, tragically. We've feared this since the beginning. All hotels are soon to close in Spain. Home lockdown is enforced in Spain. Somalia's had its first case. Poor African country. Frightening what could happen there. All schools are closed, so glad to see they're taking some proactive measures. Iran, cases increase, deaths increase. Not too much definite news out of Iran. Germany still increasing. Angela Merkel, the Chancellor, said 10 million people could be infected within months without social distancing. And we can assume that Chancellor Merkel is well advised. Schools and shop closures, of course. Angela says it's the biggest challenge since World War II. She says that community and united action are required. They've opened a 1,000-bed new hospital in Berlin, I think, converted conference centre, I think. 1,000-bed new hospital opened. This could go on for several years. Now, this was from the Robert Koch Institute, which, of course, is one of the major microbiological centres in the world. And the speaker there said that this could go on for years, probably 2 years, and that there could be waves of the pandemic because pandemics normally go in waves. So again, let's hope this is truncated by the vaccine. But just to reinforce this idea that life is going to change for everyone for some time into the future. We just have to accept that. Life is going to change. France, new cases, more deaths. Medical system at breaking point in the north now. Lockdown since Tuesday, strictly enforced. 5,000 fines in France. But emails from France are telling me that people are obeying, are complying, do understand why this is important. So the vast majority of people in France, I'm pleased to say, are cooperating fully and understand the necessity for the extreme measures that are being taken. So again, 5,000 fines throughout the country is not too bad. Let's hope it goes down to 0. Russia's had its first death, which means it's probably already been spreading in Russia. Thailand, I did mention this before, confirmed cases, increasing cases, some clusters, tourism's way down, of course. So disappointing that it doesn't seem to be inhibited by the heat. Now, it might be partly inhibited by the heat, some data does suggest that, but still spreading in Southeast Asia with a surge in cases in that part of the world. Turkey, again, first death, so it's already been spreading there for a week or 2 or 3 probably 2 or 3 actually. 100 confirmed. Oh no, that's 191. That's out of date. 191 confirmed cases now. President Erdogan has asked people to stay at home for 3 weeks. And as we mentioned, Israel, South Korea and Taiwan reporting success with mobile phone tracking, even though it is somewhat Orwellian. It does seem to be working for the time being. So that's the state we're at. The takeaway here is life has now changed. It will be changed for the next 6 months to a year or even longer. People will start trickling back into normality as they are demonstrated to have the antibodies after they've been infected, hopefully after a mild illness. So we should have a good degree of functionality again in society. But this is not going away anytime soon. Things have changed. But vaccines will come, I believe. I believe that completely. This disease will be essentially eradicated, I would hope. That there may be some endemic factors, but mass vaccinations mean that the significance of this disease will greatly reduce, and things will improve. But until they do, we just have to accept things are going to be different, I expect, for the next year or more, slightly more.